Hi, I am Alvaro and I am here to tell you about my appointment with my optometrist and my cataract surgery doctor. First, I went to see my optometrist here in South America, in Colombia, where I am at the moment. And the optometrist was a very nice person. I know him for some time now. I have been going to see him for a few times. And the last time I was there, it was in 2009. And it was extremely gratifying to see that my eyesight has not got worse since then. So in 2 years it has been stable, my RP, my retinitis pigmentosa, and my cataracts have advanced, but not so much. So that is pretty good. He did a test with me and my contact lenses on, and then with me and my contact lenses off. And the result was that everything is stable. He told me that the contact lenses that I have are good. They were made in Boston, in Massachusetts, in the States. And so that was pretty nice. He told me that he's amazed that with the eyesight that I have remaining, that is not so much, I have always the same attitude, positive, and always looking at the future in a bright side, and always happy with life and laughing and making jokes. And he says that he wished that every single patient of his had the same attitude that I have. So for me it's extremely good to have that comment done. You know, it's like a compliment from an optometrist that works with many patients around the clock and gives you that kind of comment about me. That's wonderful. You know, I really say that my attitude is what makes me successful in life and makes people want to be around me. I never see myself as someone who has low vision but who is bitter about it at all. I see someone who what wants is to help others in understanding the eye disease that we have and in making life as best as possible with what we have left. So he told me that currently I have an 8% of total sight in my right eye, yeah, and in my left eye I have about 6% total sight. He told me that in the States they measure that by the 20/20 thing. So you could say my right eye is about 20 and 250, and my left eye is about 20 and 240, something like that. So you get an idea for those who are in the States. Then I went to see my cataract surgeon. Very nice person. He was educated in Colombia as an ophthalmologist, and he was trained in cataracts in the United States in the Manhattan Ear and Eye Institute, I think it's called, in New York City. He worked there for over 6 years, and he operated on many American patients there. He was very successful. He has many American surgeons as friends, and he came back to Colombia to work at the clinic in Colombia because his family was here. But you know, he loved the States, and his experience in the States in cataracts has been very profitable for him, very good for him. So I started to say to him, "Doctor, I want to know if my cataracts are fully developed to go for surgery." He told me, "Not really. I just made a test with your eyes and it seems that it's not fully developed yet. I would advise you to wait maybe a year, maybe more. It will depend on how the cataracts progress. But in my expert opinion, what we need to do is wait until the middle, the center of the eyesight is affected with your cataracts. Is not yet, so it shouldn't be operated on as we speak." So that was important to know. He also told me that the lens they use is done by Alcon Laboratories in the States, and so they bring those lenses here to Colombia and they operate on patients with RP and others with any kind of eye problem that is complicated. They use that kind of lens. Those lenses come with blue light filters. It's very important to understand that blue light is very bad for the retina. So this lens protects you from it. So after knowing that, I was very excited, and he told me if you have myopia, I think it's called myopia in English if I'm not mistaken, those ophthalmology terms is complicated to pronounce sometimes. But anyways, you know what I mean. The myopia thing is that you don't see very well, and it's because you have a lot going on. When you are born and everything is something that everyone, I think, has myopia in their eyes, I think. So anyways, I have a lot of that. I have left maybe 12 degrees in one eye and maybe, I don't know, 13 in the other. It's pretty high. So he told me, with this lens you have the option of choosing either a near sight kind of lens, a middle distance kind of lens, and a far-sighted kind of lens. If you pick up the far-sighted kind of lens, the whole myopia goes away. It gets to zero. I know it's unbelievable, but it's true. And if you pick instead the near sight lens, it's going to remain in 1.50% of myopia, which means it would be great, but not as perfect, because I will still have some myopia left. The myopia, however it's called, is something that it has been very bad for me in my lifetime. I mean, I have had to use pretty thick, lenses in my glasses when I had glasses in school, and it was, people would laugh at me because of that. It was not great, aesthetically speaking, but not only aesthetically speaking, but to do sports and all, it was pretty bad. So I changed that and I switched to the contact lenses that are pretty good. And so he told me that the surgery is about 15 minutes and the recovery is immediate. I mean, you go out of the clinic seeing well. Can you believe that? There are no stitches to this surgery unless you choose to have the surgery done for the two eyes at once. He told me that if you have the both eyes operated at once, the risk of an infection gets high and you can get blinded by the surgery. So he told me I'm operating just one eye at a time because of that reason. He told me he has operated on many patients with RP and the results have been very good. People in general choose the far sight kind of lens because it destroys the myopia they have, and they all want that. But he told me you gotta be careful when choosing the lens, because if your life is more about things that you need to see from near sight, you should have the near sight lens. But if you are in the countryside or you're gonna work in the middle of the nature or in the middle of a wood, or maybe you are doing a lot of sports or whatever, maybe you can consider the far-sighted kind of lens. You gotta research and you gotta talk to your eye doctor about this. This is an extremely important decision. The lens cannot be changed afterwards, so it's gonna be with you forever. But I think it's pretty cool that the myopia can be gone, and in my case, for example, wake up and see well, and just use your glasses for whatever you haven't chosen. Let me explain what I'm talking about. If you choose the far-sighted lens, it means from a far away distance you're going to see okay, but from near sight distance is going to be a little bit harder to focus. So for that reason you will need your glasses on to read the computer, things like that. Or you can do it otherwise. You can say, well, I prefer the lens for nearsighted and I prefer to see from a far sight with my glasses on. What else do I have to tell you? I think that's pretty much all. I mean, my doctor says, you gotta wait. We have to be careful. When it's affecting the center of the eye, will be the right time to operate on. And he told me, cataracts today are much easier to operate on, even if you have RP. He told me I have done it many times. The results are very good. And what you need to understand is that you have to be always positive about this surgery. And it's going to be positive as long as you are positive about it. So that's pretty much it. I want to say thank you so much to the people that are following my project Low Vision Bureau on YouTube, on Twitter, and on Facebook, especially on Facebook, because on Facebook I have so many people with low vision that I am contacting and I'm talking to, and for me it's wonderful to talk with people with low vision like me, because they understand what I'm going through and I understand what they are going through. So please remember that we need to be positive about what we have and fight for our rights. I would say that one of the most important things of all is that we never lose hope, and we always remember that not having such a great eyesight is not the end of the world. Low vision people around the world have many qualities and many talents to give to society. I started Low Vision Bureau because I believe low vision people deserve better. We deserve to be respected, valued in society in a very active way, because society needs us. That's the reality. So always remember to be hopeful, and if you want to talk with someone who have low vision and understands you, here I am. If you like this video, please comment on it. And remember that I'm moving to the United States probably in 2 or 3 years, and I'm going to come to the United States every year, like I did last year, that I was in New York and New Jersey with my cane, Mr. Magoo. I think it's a pretty good name, Mr. Magoo, for a cane, don't you think? It's nice, it's hip, and it helps me so much, Mr. Magoo. It has been a world of difference, to be honest with you. Walking through the streets of Manhattan alone, but with my cane, it has been wonderful. During the day and at night, taking the train. Now that I'm in South America, in Colombia, it's the same. I use it here all the time. Obviously, here is much harder because people don't understand. People are not as civilized as they are in the States. But nevertheless, people respect me. They have to, because I make myself being respected. And I think there's something that we need to understand about our low vision. We deserve that respect, And the reality is that we are a first class people, and we have the same qualities that anyone else has. And we need to take advantage of those qualities. And so I invite you all to follow us, all the project that I'm creating on Facebook, Twitter, YouTube, and I have many friends with low vision that are helping me. It's because this baby that I call Low Vision Bureau is only created by many people. I started it, but alone I cannot do it. So that's why I have many people on board that believe in this and are going behind that. So remember to be always hopeful. And cataracts are not the end of the world. RP is not the end of the world. What matters is to live life to the best of your capabilities, to the fullest. Remember to always help others in need, because this is not about only you, it's about everyone else as well. And have dignity. Be always happy for who you are. Never forget who you are. We may not see so well-sighted people, but we have so much to give them, so much to teach them. Remember always that. So if you like the video, tell me. I would like to make more videos, but I need your help. If you like it, let me know. If you don't like it, tell me to. And hopefully you're gonna have a wonderful day. And please take care of your eyes. Okay? Okay, have a great day. Bye bye.